Welcome back, everyone, to OpenLine. Glad you're with us, talking about mental health awareness. What are some things that we can do to help? Hopefully this can help people. We have with us Robin Nobling. She's Executive Director of the National Alliance on Mental Illness here in Davidson County. And I want to talk about the impact of how people see mental illness based on, I guess, their gender, their ethnicity, their age, their faith. Yeah. So their culture impacts how they see mental illness.
Absolutely.
Is that right?
Absolutely.
And how does that work?
So, so culturally, let's take people who are gender diverse. Right now, there is a huge impact on them in society. So we know that they are 4 times more likely to have a suicide attempt. Some of this coming from internally as they're having their struggles to figure out who they are and their own self-identities. And sometimes in families, that is not always welcome. And that can be very, very difficult. And then in society, that can be very, very difficult. And then just basically kind of finding your tribe. Where do you fit in? So gender can be a real big issue. Age is there's a lot of we're invited to, whenever we're invited to talk to at a senior tower, you know, as a senior community. I don't dive right into mental health because they were taught not to talk about this. We spend the first 10-15 minutes just chatting socially before we will ever broach this topic, because otherwise it's not going to.
So that generation,
generationally,
we're not far removed from when they just wouldn't. They weren't going to go there.
You were not supposed to talk about that.
Yeah.
That's not. Don't you bring that business out. And again, in the African American community, you don't bring your business out there. But what's really wonderful, and we are, as an organization, we have been for I think 8 years now, a member of Suicide Prevention in the African American Faith Community Coalition, and some wonderful folks and partnerships that we have over there. We are so. I'm so delighted and heartened by our association there. And so in that community, we know when we go to the African American community, if we want people to hear the message about mental health, that we need to go to the minister, because that's where people in that community congregate. A lot of times is in their churches. And if the pastor will say, you know, things about this from the pulpit, chances are it'll get heard. Now, we know in the Hispanic community, in the Latinx community, that it's done in families and community. So that's when messages are going to be heard. There was an opportunity, it's been about 5 or 6 years ago. There was a small Haitian church here in Nashville that invited me in, and they had 4 families out of 100 that had people in a psychiatric hospital being treated. Unfortunately, in their language, they didn't have words for schizophrenia or bipolar disorder. And the only thing that came close to describing what was going on was demonic possession.
Oh, wow.
And they wanted to be informed, and they wanted to, and so we're talking, this affects families and people with the condition. So I went out to my counterpart in Miami and said, I know you have a large Haitian community. I don't need something in Creole, but do you have anything in French that would be helpful to this community? Have you already done this? And they said, yes, we have. So they shared that, and I shared that with the community. We had the Nepali community come to us. We've worked with the Eastern Indian community. And so each community can be just a little bit different. One of the communities you don't see us working a lot with is veterans. They're a closed community. They're a community of strength. Now, with this new Partners in Care program that's going on within the department of the police department, now while we talk about it being for the community, what's going on within the police department is more peer-to-peer support for officers.
Which is needed. We talked about that program the other night, and that's such an important program.
That's wonderful.
Let's go to the phones. Let's go to Regina.
Right.
Hello, Regina.
Yes, hi. Thanks for taking my call.
Yes.
I was just thinking about an issue, too, that exists in the mental health arena, where sometimes it's very difficult to get the kind of help that you need. I find, in my own case, there are people who are working in some of these these psychiatry clinics, who are support staff for the doctors, and as you know, they usually fill out the forms, etc., for the doctors. But some of them do not seem to have the empathy or the concern about that patient. In fact, they almost treat you as though you are bothering them, you're a nuisance. And they even falsify some documents to make it appear you're not as ill as you are. And it seems like that would be illegal. And if you're having these type of problems, where can you go to get help to hold them accountable?
So one of the things that we do, NAMI is known for support, education, and advocacy and awareness. And if you have a concern like that, you are welcome to call us. We will help to guide you through what's going on there. We have relationships with almost all the major providers here in Davidson County. And occasionally, we have what I like to call teaching moments. And so we have good relationships so we can have teaching moments. And when we get a call from somebody and we listen to what we're hearing, and now I will first say to the person such as yourself, Regina, I might say, you know, please tell me more about that. What have you done to resolve the situation? Have you tried, you know, X, Y, and Z? And so I like folks to try to do their own advocacy first, because that's how you learn to do advocacy, self-advocacy. But when we know that you've done that, when you've tried that and things are going on, then that might be a time that we would step in as an agency. And so, you know, we know a lot of times, we know that people can have bad days in places wherever they are, those workers can. But if it's something that is more systemic, I think it's important that we know and we bring it to people's attention. Mm-hmm. So I thank you for that. I thank you for sharing that.
Thank you. Yes, thank you, Regina. Let's say there's somebody out there watching right now. They're worried about a family member. What do you recommend that they do?
So one of the things that's really, really hard is, and this was the call I had this for 40 minutes this morning from Alexandria, Virginia. Very often, it's very, very important that we give people rights. And people have a right to be different. People have a right to fail forward, as I like to say, which is they have an action, they face a consequence. Now, sometimes when they're very sick, they may not understand what is going on. They may have psychosis or in some way not be reality based, but they don't rise to the standard, which. Not thrilled with the standard. The standard is, are they a threat to themselves or others? And, you know, we have another organization, I'll mention Mental Health America, who is, you know, sometimes that NAMI and Mental Health America will partner in things, especially legislatively. But before stage 4 is something that is said in the mental health community. And what that means is, if somebody had cancer, you wouldn't wait till it was life and death. You wouldn't wait for it to get to stage 4. You try to intervene beforehand. But we want to be careful when we do that, because NAMI is supportive of both the person with any mental health issues, and they could be issues that might not be a specific disorder. It could just be an issue. And the family members. So family members see things. They know things are going on. The person may lack the insight to know they're going on, or may not want to change. Our role at that time with the family member is to help work with them.
Right.
And to go, you know, come into our family classes, come into our communications classes. Maybe we can help you identify that. Maybe we can help you learn something about this condition, and you might be able to steer, or, you know. And so when you've got, you know, it can be very difficult when you have that. But what we try to get people to do is, one, take a look at what it is, understand it, have compassion and empathy. Have compassion and empathy for yourself as a caregiver. Set boundaries, very important, and seek help.
And you said you don't like the standard. The standard now is harm self or others.
You've got to be, you know, you've got to be in a pretty bad way. Now, at the same time, we're trying to balance people's rights, and that's important. And that's very important. But we also, I call it the in-between place, when they're not quite, they don't rise to, but we all know, you know, they're in a bad way.
All right, we are going to take a break. If you want to call in, there's the number, 615-737-PLUS, 615-737-7587. Take a break, be back right after this.